Hi everybody, welcome to Brain Injury Hawke's Bay Community Collaborators. Today I'm speaking with Erin from Healthcare New Zealand. Thank you so much for joining us, Erin.
Our pleasure to be here. So I'm Erin Timor. I'm Regional Clinical Manager with Healthcare New Zealand. With Healthcare New Zealand for the past 6 years. I am an occupational therapist by trade and currently work in the role supporting our clinical staff that we employ and clinical policies and processes that get put into place across the region, which for us is East Coast and Wellington. And yeah, love working with Healthcare New Zealand, love being able to support people in the community, and I have in community and rehabilitation services, so this sits quite nicely for me.
Great. Can you tell us, Erin, about Healthcare New Zealand?
Sure. So Healthcare New Zealand is a leading private company delivering health and wellbeing services to people in the community in their own homes. We have service cover from the far north all the way down to Invercargill Bluff and different branches across the country. We have a mixture of different staff roles, with the majority of them being support workers who work with people in their own homes, and clinical staff. So all of our clients have an allocated registered health professional to provide some guidance and support and assessments for those client groups.
Excellent. Would you like to tell us a bit about the role of your support workers?
Sure. So our support workers definitely the company running, and also continue to provide the bulk of the support to the people we support in the community. So our support workers' roles will vary depending on the client group that they're working with, because we can service or support people with a range of different health, disability and social support needs. So in regards to the support workers' role with people who may have had a or traumatic brain injury, they will be working with people in their own homes predominantly and into the community to support them with maintaining their independence and living the lives that they choose and want to be able to live. It can range from anything from helping people to maintain their personal hygiene and personal care tasks at home, prompting and support around medication. It could be working alongside to maintain household hygiene, and can also be things to complete grocery shopping or plan their week or engage with other services that exist in the community.
Excellent. So I mean, really you're just giving people that independence, which is so important, isn't it?
That's right, and for the majority of the people we support, it is about them being able to live independently at home, and a large number of them are living independently on their own without us in the home. So sometimes we be the only visitors that they have in their homes as well.
Yeah, so your support workers must get quite a bond with a lot of people.
They do. It's definitely a very special role, and it's a privilege for our teams to be able to go into people's homes. But definitely relationship and rapport is quite key on us being able to have our clients and the people we support feel very comfortable having people in their homes.
Yeah, absolutely. And so how have you been operating through COVID-19?
So like all services, we have had to adapt and adjust to how we interact with people, how we deliver support. But the key for us has been making sure that people who require essential supports in the community to stay healthy and well are still receiving that. So for our support workers, that has been around them having access to refresher training around infection control and supply of personal protective equipment. But they are still continuing to visit people in their homes and deliver essential supports. Where we have been able to, other support roles and clinical staff have been working remotely, but still continuing to provide contact and support and assessments for people with the use of telehealth.
Great. It is. It's an interesting time for us all, isn't it? Changing the way we operate and just doing the best we can.
It sure is. Forward for us too, it is going to be around maintaining and ensuring that people are maintaining really good infection control processes into the future, which will be a positive outcome for everybody, regardless of COVID. And I think the community awareness around social distancing and the increase in infection controls will support us all to live healthy and well in the community long term.
Yeah, absolutely. And you were mentioning before, when we spoke earlier, about a website where there's some resources around learning about these things?
That's right. So all of our support workers have access to a training company that is part of Healthcare New Zealand called MySkill, which provides training and education courses both at NZQA level but also with topic-specific training. And currently, MySkill has got some free training courses on infection control and personal protective equipment, which is accessible on their website myskill.co.nz.
Excellent. So we'll pop a link up to that as well when we post the video. That's a great thing for us all to be able to pop on and have a look at and learn how to keep ourselves and everybody safe.
That's right.
Excellent. Thank you so much for speaking to us today, Erin. Can you just quickly tell us how can we find out more information about Healthcare New Zealand?
Sure. So our local branch is still continuing, and we can be contacted on our main office phone number 0683442214. But our company website, healthcarenewzealand.co.nz, has got lots of useful information. It's got all of the different contracts that we will support people under, and also currently has lots of really good resource and information around COVID. So that's healthcarenewzealand.co.nz.
Excellent. Thank you so much for joining us today, Erin. Really appreciate hearing about your role and about the great work Healthcare New Zealand's doing.
Thank you.